want anything.
Oh, Agnes.
Mom!
Now she's dead.
I like that there's a doctor there. Skiing mishaps, magic potions, and an unhinged border collie that gets into all sorts of trouble. What? Today we are breaking down and reacting to all of the horrifying medical scenes and injuries from Mr. Pickles. All right, let's dive right in.
It's a lot, you stupid dog.
Oh my gosh, come on, this dog again. Okay, first off, the bag over the head. We all know nobody should do that. Risk of suffocating, asphyxiation, meaning basically you're not getting oxygen in, so you're not getting oxygen into the lungs, so you can't have gas exchange where the oxygen meets the red blood cells and they exchange O2 and CO2 and all that very much complex mechanism that happens there. And all I see is the dog having a massive pile of people. When somebody does die, the body does go through decaying processes that happen at specific times. And what's really crazy is they actually know the specific events that happen during the decaying process because they actually watch a body that has been deceased decay over time. Oh my gosh, the dog coming out of the body, but the skin sheds away, but we're left with the skeleton there, which is actually pretty impressive, minus there's nothing anterior, there's no rib structures anteriorly, but you see the vertebral column, you see the posterior ribs, and you see part of the pelvis. Spike right through the back at the base of the skull, going through the mouth. Okay, you think, oh, okay, blood through the mouth, that looks, scary. Obviously it does, but you worry about the spinal cord actually and the brainstem at that point.
And the feds put me in the witness protection program. They extended my forehead, my feet.
Oh, itch? Okay, very good. So extending the forehead, so putting an implant. You can actually put implants into the body where the tissue shouldn't actually, and the body wouldn't necessarily reject it, and it sits underneath the tissue. People do this to change their look. Now, elongating their feet, I've actually never heard of that. There's probably a possibility to do that. I do know that there are surgeries where you can elongate like your tibia or like your femurs, those sorts of things.
I like others.
Oh my gosh. Impaled object straight through the head and then ripping somebody's face off. Like, come on, we know that this can't happen. When the tissue comes off the face, you see these lines over the red areas, and it's actually trying to show striated muscle, which is a muscle that we have control over.
You gon' get it all right.
Holy cow. Cervical fracture by significant rotation. So people get worried about this, say, when they go to a chiropractic's office, right? They're not twisting in a direction like this. They're using multiple planes of force, so that way no one plane is going to its extreme, basically causing more injury. Now, interestingly enough, we have blood coming right out of the nose. Could that actually happen? Well, if there's an injury to the throat, you can potentially could come back up.
Tommy's gonna dance with a giant zit.
Kids are calling it a giant zit.
But it's what's on the inside that matters.
You see this green, we use the word called purulent material coming out, and it could be brown, yellow, green, white. Sometimes it has the worst smell in the world. Situations like that, if I have to deal with somebody who has an abscess and I need to help take care of that and relieve that pain, I will actually use a suction device. What I'll end up doing is cutting it open, having the suction, and have it just go directly in there. Oh, everybody's coated. Matilda looks normal. So if the skin was stretched that much, it wouldn't return that fastly back to baseline. But if your skin is stretched to a certain point, over time, it'll stretch further. And if that occurs where it's a long-term stretching process for whatever reason, if you lose weight too fast or fix the problem too fast, you may be left with excess skin that hasn't had the chance to retract. And at that point, sometimes you might need to have surgery to have it removed.
Huh? What the heck? No.
Wow, just cut off the face. You'd probably actually get some teeth if you actually cut all of that off. The eyeballs, see how they're red? The insides of our eyes are not that. It's actually clear fluid. But it's not affecting the airway. It's just hurting the front part of your face. This is something that is not potentially immediately life-threatening. Obviously, you may be blind. Obviously, you need significant reconstructive surgery, but it's not affecting your heart, your lungs, or your airway.
Who wants a piece of this?
Oh my gosh, Mr. Pickles using a ping pong paddle. Unlikely that that would occur, and unlikely that much blood squirting around. Most of the time you probably get a laceration to the skin and some blunt trauma with a ping pong paddle.
I'll do anything you want. Anything.
Oh, Agnes. Now she's dead.
I like that there's a doctor there. Sometimes in the pre-hospital setting, you can pronounce somebody dead if there's no signs of life, and that's literally rigor mortis is set in. If there's lividity, which has to do with basically some skin changes on the flanks, dealing with pooling of fluids and blood, if somebody's been down for a very long time. A lot of times, you know, you don't want to try to resuscitate somebody after 6 hours when it's not going to work. The brain tissue is already dead, and trying to revive that individual is not feasible.
It was so much easier.
I don't even know what this is. Each layer coming off was quite impressive to actually just see. For me, as a physician, as somebody who knows anatomy pretty well, I don't know what the outer coating per se is. Now the skin's peeling off, and then underneath that you have the skeleton. So actually pretty interesting from that standpoint.
Hey, no dogs allowed!
What?
Get that dog!
So Mr. Pickles always going for faces, but ran right through that person's body, and you actually see some organs go flying. I saw some kidneys flying around there, and then obviously high cervical fracture on the other individual. So people ask, well, how long of exposure to flame or fire could these type of injuries occur? Knowing maybe what caused it, a flame, a chemical, hot water, hot food, is helpful, and making sure that an individual is decontaminated from maybe whatever has caused the burn is something I need to know. And he is using the body as skis. Body's cut in half. Body would not survive this. You see the anatomy. You see basically the face cut directly in half, and you see the different hemispheres of the brain. Super cool. And you see redness within the bones, and that probably is the bone marrow that they're trying to show. We actually do bone marrow transplants for individuals who need it when the bone marrow is not working right, where a cell is overgrowing. Mr. Pickles is on a whole nother level. If this dog was ever around and caused injuries to individuals, they would actually be quarantined, rehabbed, or make sure they don't hurt another individual. Seeing some of the anatomy and the creators adding anatomy into some of these injuries is actually interesting to see. If you guys did enjoy this, definitely check out the rest of the channel. Check out this playlist right here, binge watch everything. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.